Hello, and welcome to our webinar series showcasing the outstanding work of community agencies across New York State funded by the New York tax checkoff dollars to reduce mental health stigma. I'm David Minot, Executive Director of Mental Health News Education, publisher of Behavioral Health News and Autism Spectrum News. I'm honored to have the opportunity to highlight these impactful projects and share with you the details of this important stigma reduction work. This series of webinars aims to highlight the innovative efforts of 7 organizations funded by the New York State Office of Mental Health for Stigma Reduction Community Initiatives in 2022 and 2023. We'll learn how these agencies identified targeted audiences within their regions, tailored their engagement strategies, and chose their interventions to address specific types of stigma impacting their communities. Stigma remains a significant barrier, discouraging individuals from seeking mental health support and limiting opportunities for those experiencing these challenges. However, local community providers possess invaluable knowledge about the populations they serve, positioning them uniquely to develop the most effective anti-stigma interventions through tailored outreach, marketing, education, and contact-based efforts. Over the course of these 7 webinars, we'll dive deep into the real-world experiences of these agencies to explore their methodologies, the challenges they faced, and how they measured the impacts of their interventions. Their stories offer a wealth of insights for other organizations looking to implement successful stigma reduction initiatives in their communities. We will also examine the key elements essential to any stigma reduction project, including understanding the target audiences, defining engagement strategies, setting clear goals and deliverables, and developing mechanisms to evaluate both qualitative and quantitative outcomes. Ultimately, these webinars aim to stimulate broader interest and collaboration in the fight against mental health stigma and increase mental wellness across New York State and beyond. We will include contact information at the end and encourage you to reach out to today's speakers to discuss how you can replicate a similar project in your own community. By fostering community coalitions, we can amplify our collective efforts and drive meaningful change. Today, we'll be speaking with Steve Buljar, CEO and Executive Director, and Michelle Truitt, Marketing Manager at Integrated Community Alternatives Network, or ICAN. We'll also be speaking with mental health ambassadors Liz Ellis, morning show host on KISS FM and promotions director at Roser Communications, and Al Morrow, youth care coordinator at ICAN and professional mixed martial arts fighter. Once again, thank you for joining us and enjoy today's presentation. So Steve, how about we begin by telling us about Integrated Community Alternatives Network, better known as ICAN. Where in New York State are you located? What services, programs, and activities are provided? And what is the mission of the organization?
Yeah, ICAN, we're located right in the heart of New York State, right in the Mohawk Valley. We're a relatively young organization. We've been operating since the late 90s, but provide a whole host of services geared towards families. We have a mission of empowering individuals and families, and the way that we do that is by providing services today prenatally through end of life. But everything when we started in the late 90s was rooted in children's mental health. And now that has evolved to providing services from across 7 counties to 23 programs. We're working with over 2,100 families every day with an ultimate vision of keeping families together. If we can strengthen and empower that individual family, we feel that that's the fabric of our community, and stronger families mean stronger communities. And that certainly was the case here with our effort to help reduce the stigma associated with asking for help with mental health.
Absolutely. So what type of mental health stigma, meaning self-stigma, public stigma, structural stigma, institutional stigma, what type of mental health stigma do you feel the ICAN Mental Health Anti-Stigma campaign has been most effective at positively impacting?
I think we're very proud of the success that we had across the board, and I would say it's the easy way to answer the question by saying all of the above. But I really truly do think that our team at ICAN was successful in addressing all of those areas of stigma, and we felt that it was important really to start first with that self stigma, that way that people hearing the message and understanding and knowing and reflecting on themselves first, whether you're a student, and we spend a lot of time focusing in on kids, whether you're a parent, because families are, as I said, so core to everything that we do at ICAN, teachers and schools, all of those. If everybody starts with themselves first and focuses in on their own mental health, and so much of the messages was geared towards the idea that mental health is something that everyone has, and it doesn't necessarily have to be associated with a mental health diagnosis. How we're feeling individually impacts all of those that are around us. And if we in turn are taken care of and our mental health is taken care of, then those that we're closely connected to will feel it as well. It's easy for those of us in the field to understand and want to protect mental health of those that we serve. But if we can even just boil it down to the most basic levels where everyone understands mental health is something everyone has in the same way that they have their physical health and can focus on their physical health. If we can normalize it in that matter, that truly was our way to really address and get to the core of the stigma and really have that positive impact.
Sure, that's great. So what was your target audience for this campaign, and why did you choose that demographic?
So for us, as I shared a little earlier, we started in the children's mental health field, and today we provide services across the lifespan, provide mental health services to kids and adults. But with this particular focus for this grant, we really wanted to boil it down to kids and students. And the target audience that we had was middle and high school students, because what we were seeing with kids and really what was happening not just during the pandemic, leading up to the pandemic, but really what was exacerbated during the pandemic. Kids need support, need to understand and realize the feelings that they have, and maybe what they're facing is very normal and something that most kids are experiencing. And being able to share that message with kids, especially as we're seeing our trends locally, trends at the state level and the national level, instances of anxiety and depression are higher than they've ever been. The collective trauma that we've all felt as a community, if we can focus in on our kids and make sure that our kids are doing well, then that ensures a bright future. But the piece that I think that maybe most of the adults that we worked with and the ambassadors that we partnered with, while it seems like we are and able to address and focus in on kids, the message permeated into all of those that are supporting kids as well. So teachers heard the message, principals heard the message. When it was on the radio and print and everywhere you could see it, while we're focusing on kids, the greater community was positively impacted. But we also felt, and it was validated through the course of the campaign, that kids are ready for this message. Kids are very comfortable in talking and understanding their mental health, and even what they're learning or maybe seeing at school, we feel can and will and did trickle into their home environments, their sports teams. If kids feel comfortable talking about it, recognizing it, and seeing they themselves become an ambassador for their friends, and the message then becomes contagious.
They certainly looked engaged when they were interacting with the ambassadors in the videos that I've seen. Um, so what were the anticipated results or deliverables expected from this project?
When we first started talking about it as a possibility, the goal that I had in my seat was, even if one person hears the message, then the campaign was a success. While we really focused in on normalizing mental health to eliminate the stigma associated with it, we know that there are kids that really would benefit, that are really struggling in their lives and are facing challenges right now, that if they hear the message and understand and it resonated with them, there is the possibility, and I'm confident that this message is saving lives at the same point. So it's very hard to measure that, but we know in our core and the work that our mental health ambassadors did and continue to do today that kids connect with them and see them, and they're all stars. They're people that are in the community that they can respect, look up to. They were before the campaign. Now they'll continue to do that. And if that message resonates with just one child and in turn saves their life, allows them to be more productive and maybe get the help that they need, reach out and ask for support, that's the ultimate deliverable that makes it all worth the while. But increasing the awareness with the schools that we're stepping foot in, this was sometimes the first step in the door to a conversation that now we have school partners and we're equipping teachers and administrators with the tools that they need to be able to continue the conversation after our ambassadors have gone. So from one child to impacting many in school communities and the community at large, this initiative has been a tremendous success, and I feel we've hit all the deliverables and then some.
Yeah, I couldn't agree more by seeing all the outcomes. So, can you provide an overview of ICANN's OMH-funded mental health anti-stigma campaign?
Absolutely. We were able to do this amazing, like multifaceted campaign where we used traditional and digital, and we brought in mental health ambassadors, which I think was really the key to the campaign. If that's okay, I'd love to go into the talking about the ambassadors and kind of how we
Please.
recruited them.
Yeah,
All
absolutely.
right. So the mental health ambassadors were really key. We identified people in the community based on a few different things. Their advocacy and the fact that we knew that they talked a little bit about their mental health already just by knowing them. We work with them in the community. They work here at ICAN. And we had, they've got great platforms. They have great influence in the community. They're relatable. So we had Liz, Naz, and Al, who we'll talk with. And we had like a perpetually upbeat morning DJ on the radio. We had an excitable, really energetic hip hop artist and business owner. And then we had like this real tough guy, professional MMA fighter, which happens to work here with us at ICAN. So they were this great group of people that didn't know each other until this campaign. So how we onboarded that's one of my personal favorite things to do in the creative world, is to make something awesome out of nothing, right?
Mm.
So we decided to do these ambassadors, and we're like, we need to onboard them. We need to know their stories. They need to know each other. They need to know the purpose of this campaign, and let's get them together. So we had like initially just a lunch. We got some food and we sat together and introduced each other and they talked about their mental health, really. And we focused in on the pivot for them. They said, like, here's how I was feeling when I was this age. Our audience is really honing in on teenagers, preteens, really those like 14, 15, 16 to 18-year-olds in our community
Sure.
that are struggling with mental health. So what were you guys like at that point in high school, right? And what was
Hmm.
your pivot? When did it happen? How did it happen for you to become, in control of your mental health, to embrace it and to know the ebbs and flows and to handle it in your own way on an everyday basis? So they all shared those things, and it was really neat to see them kind of commiserate with each other and pick up on each other's cues. And that helped our marketing team in that room start taking note about, like, this is that nice little piece for Liz's story. And I like really what Naz said about this, and we can build that for his things. And so we left that meeting and had kind of a litany of great things that we were going to do for the campaign. So everything from a professional photo shoot and using our equipment that we were able to buy with the grant, we did like all the implementation and creative was done with our ICAN in-house team, our marketing development and events, everybody working here.
Oh, that's
We
great.
did it all internally, which was really cool. So we had great resources and different things to do that with. So we also recorded them. So Liz works at a radio station, which was a beautiful platform for them to go down. We had a content day and we did their interviews, which were aired on the radio station, which is our top 40 station here in Utica. It plays, it appeals to people like me who are in our 40s who love some great hip hop, as well as the kids and teenagers. And it's got a good widespread listenership. So Liz was able to bring them on, pre-promote the interviews, and then we had 30-second radio spots which they recorded as well that day that were crafted from that initial meeting we had together. So it was phenomenal. We did a photo shoot which resulted in us doing posters and postcards and autograph cards and lots of different collateral that went out. I'd like to pivot for 1 second and talk about the actual campaign slogan and how that came about. So we sat, our creative team sat here and we're 20s, 30s, 40s, we're sitting in the room starting to talk about what we want to say and how can we cut through the clutter. We did a lot of local and regional research, and as you know, there's so many there's little nonprofit organizations in little towns that are doing their own amazing little campaigns, and then there's national stuff. If you just watch the Super Bowl, the NFL is really highlighting mental health and talking about that. So there's the gamut. A lot of people are saying a lot of things about it. So we're like, what is going to make us different? What's going to be good for our community? What do we say? What hits hard with our target audience, which is teenagers? We look around the room, we're like, we're not teenagers anymore, right? So we decided it would be best to do an online survey. So we put together the survey, disseminated it, of course, through all of our Facebook and TikTok and whatever outlets that we had. We have an amazing group of over 270 people who work here at ICAN. A lot of them are mental health practitioners. We have a huge IPA network, our Independent Practice Association. So they are folks in the community that are doing all sorts of behavioral mental health mentoring. They're working directly with our kids. So we had a great way to disseminate this online survey out. We asked the students or the kids, like, what does mental health mean to you? When you hear mental health, does it have a negative or positive connotation, and why? How often do you think about your mental health? We asked them, who do you talk to when you feel like you need guidance or advice on your mental health, and how can the adults in your life help you? And we got some great feedback. We had about 150 responses. And one thing we found that was almost half of them said that they think about their mental health every day. And another 30% thought, they think about it here and there. And then we kind of looked at some national and regional campaigns. We talked with our mental health folks who work here at ICAN and said, what do you say? And just by working with them, we pick up on some of their vernacular and things they say every day. And there's one in particular who's always like everybody's got it. Everybody has mental health. So we're really trying to equate it to your physical health. Everybody has that. Some days you might be, I was sore the other day from snowboarding. So physically, I'm not feeling so hot that day, right? But other days I feel like I could go run a marathon. Same thing with mental health. Like sometimes you're just going to have one of those days you need to ride out, and other days are going to be awesome and you're going to bring everybody along with you and the excitement and great things you feel, right? It's ebbs and flows. So taking pieces from what we hear on an everyday basis, and then taking pieces that we got from that survey of teenagers, we came up with the phrase mental health. Everyone has it every day. And we were looking for something. It was very funny because I was out in Rochester, New York, where my best friend lives, and we took a walk in the morning and we were talking about our own kids. I have a 23-year-old. She has teenagers. One just went to college. And I was telling her, we're doing this project. I'm really trying to hone in on what that slogan's going to be. What's going to be hard hitting for kids? How's it going to resonate with them? And we were talking about this stuff, and it kind of came up on that walk. And I'll never forget where I was. And came from a genuine place of us talking about it as parents to be able to help our kids. Right. So we brought that back. We shared it all throughout ICAN and shared it from, top to bottom. Just said, what do you think about this? Give us some feedback. And everybody seemed to really gravitate to it. And then we introduced it to the mental health ambassadors because they were going to have to live and breathe that and kind of sell it for us,
Right.
And that first meeting, we threw it out there and they're like, that's going to work, So that was our slogan. So we came up with, the graphics, the theme behind it. This is one of my favorite things. We did these autograph cards, which when the ambassadors ended up going out to some different groups at schools, We have a beautiful community education and training department here at ICAN. So we're in a lot of schools doing a lot of different trainings on a lot of different topics. So we were able to take the ambassadors and work them into things we already had scheduled. So Naz and Al in particular went to a school district, and there was 225 students coming in and out all day from middle school to high school and getting presented Al and Naz's story, a hip hop artist and a professional MMA fighter talking about, this is mental health to me. This is how I, deal with it. This is how I get control of it. This is how I live with it every day. And these kids gravitated to it. And they had these autograph cards where they were signing it,
That's
and the
neat.
kids lining up to get them.
Yeah.
And on the back, it's got that particular ambassador's story. It has a little bit about ICAN. It's got the 988 lifeline. So it's informational as well for that.
Very interesting. That sounds like you had a lot of fun and, really a lot of engagement with the community.
So the campaign deliverables, again, we were able to take traditional outlets as well as digital outlets. It's a great time to work in advertising and marketing because we have so many different platforms that we're able to use. And our market here in Utica, New York really straddles that. We have a lot of print, we have a lot of outdoor, we have like radio and television. Local media matters here. So we were able to use those as well as social media and all the good things that we did there. So we did a poster campaign with the professional photos of our mental health ambassadors and their story on there. And they were in all of our sites, and we got them out into the community a little bit, and they were set up as triptychs. So they were put out 3 at a time with Liz, Al, and Naz, so that they were kind of like a little gallery of mental health, so people could interact with them. So every time they rode elevators, they were reading those stories about, that consolidated story of what Al, needed, what his pivot was, and how he positively deals with his mental health every day. It was there in front of people every day. So we were also able to do the radio interviews. We were able to do 30-second radio spots, and we were able to work that into ICANN's annual advertising buy. So we got to put that on a lot of different radio stations that reached different people. So we had some good reach there. And then, of course, our social media, and then these ambassadors who have great social content as well, and social platforms, they were able to share those out with their followers. So, social media does what social media does, and it really amplifies the message for us. We repurposed each piece as far as we could go with the campaign. So we would do the video, we would put it on YouTube and social, and then be able to put out into a news story on each of these ambassadors on our website that had all that content there. We were taking behind the scenes pictures and behind the scenes video of them in the studio making that. We were able to do a video of Al and Naz when they're out, where there's 225 kids in this gym listening to them and showing them. So we tried to just really use our content and repurpose it and just amplify it in every way that we possibly could. We also got some giveaways, which is great. People love stickers, and especially like now with the Stanley Cups, there's stickers everywhere. Across ICANN and beyond. I've seen some kids with laptops in the community with our mental health stickers on there. So we just had, like, everyone has it every day. And those stickers went out all over the place. We got hundreds and hundreds of them. As our programs are out tabling in the community all summer, we were out at different community events, and we go to different job fairs. And those are a regular piece, a signature piece that we go out with tabling. We got little buttons. Those are really popular right now as well. And I'm trying to think of what else we got. We did, I love this one little piece. We had kind of a worksheet where we took each of the ambassadors kind of ended up with a catchphrase type of thing. So Naz, for instance, who's very entrepreneurial and very, excited, his phrase at the end of his radio was, "Find it, do it every day. Find something you love." His was music. It could be art. So the question is, like, what is something that you love that you can do or practice or work on every day? And we give this to the kids in the group so that they can use this as a worksheet and a self-reflection to find out, what are some things I can do to help with my mental health. Liz's advice was, find your people. So it says, name 2 people that you'd like to reach out to or get to know better in school or in general, right? Take an action, and that will help. And Al's was, be sure to reach back and help others. So now he went through his things, and now he's reaching back to his clients and the kids that he coaches. So like, is there someone at school or in life that you notice needs a little bit of love, and reach out to them. So
Yeah.
this was a great piece. I mean, there was just so many things between, video, audio, each one of these ambassadors. I didn't anticipate that they would be so good at doing this, speaking authentically, speaking from their heart. Like, they're just well spoken. They hit on those great parts. And one of the best outcomes of the slogan and of the campaign is that they're using it in their everyday vernacular. And I saw them starting to do it while they were recording, and they were like, hey, you got it every day. And Liz will say that on the radio, and Naz will say that when he's out in schools, and Al will say that when he's coaching. And I hear that here at ICAN as well. The ambassadors don't stop with the people that you hire to be the faces of it. You, in return, are getting quite a few different ambassadors within the place that we work. So just the other day, we're almost a year out from the campaign, and I was in a meeting and somebody threw up their hands and they're like, yep, mental health, everyone has it every day. And they're remembering it and they're using it every day.
Liz and Al, thanks for taking the time. Pleasure to meet you. Please introduce yourself and tell me your experience being a mental health ambassador for ICANN's anti-stigma campaign.
So I'm Listen It's Liz, or Liz Ellis. I am the morning show on-air talent for KISS FM. And when Michelle brought this idea, this project to me, I thought it was such a cool campaign. I like to talk about mental health on the radio as I do, but again, nobody wants to necessarily be brought down all the time on the radio. My job is to be fun and have a good time and whatnot. So being able to have that whole month to talk about mental health and be able to talk to amazing people like Al and Naz, that was such a cool way to kind of open up the gates to kind of talk about mental health. So that was a little bit of my experience.
Hey, it's Listen, It's Liz, talking mental health. You hear me on air each day, full of energy and positivity, and most days my mental health is great. Some days, my brain is my worst enemy. Anxiety, being overwhelmed, pressure, all the things you're feeling, I feel too. It's the day-to-day of knowing yourself. Manage your lows and ride the highs. And know when you need to talk to someone or need help. Mental health, everyone has it, every day. You're definitely not alone.
Supported by the New York State Office of Mental Health and ICAN.
Thanks, Liz. How about you, Al?
My name is Al Morrow, and I am a youth care coordinator here at ICAN, but I'm also a professional mixed martial artist outside of this job, and my nickname is the Postmaster. It was a great experience for me because as an athlete, whether it be through college and whether it be, working with my clients as well, mental health is a daily part of my life. Being diagnosed bipolar at a young age myself, and going through my own things, I try and really make everyone known it's completely okay to be open and upfront about it. Everyone does deal with it every day, and I stand by that slogan every single day now. So it was a great experience for me to work with everybody.
I'm Alex Morrow, a care coordinator at ICAN and a professional mixed martial arts fighter. I was an angry kid, rough childhood, was diagnosed, struggled, the whole nine. Thank goodness along the way, I decided to focus on me and learn how to master myself. When I was told I couldn't, I worked hard until I did. The barriers I had up, I toppled. Listen, mental health can knock you down, but on the good days, it can lift you up too. Mental health, everyone has it, every day.
Supported by the New York State Office of Mental Health and ICAN.
So how have you been continuing the work of reducing mental health stigma in your jobs and everyday life since the project?
So one thing that has been cool is as we deem ourselves the Avengers of mental health, it's been nice to have other people that kind of went through the same thing as well. And one of the things that is big for me was it opened up the ability to know that people wanted to learn or hear more about mental health and how you can take care of yourself. I loved talking with Al and Naz because we all had very different ways of what we wanted to kind of talk about, and talking with these kids was also a huge part. So going forward, now it's just been a lot more about communicating with my listeners, what I'm going through every single day, and that it's okay to not have a great day all the time.
Al, how about yourself?
How I've been continuing it?
Yeah.
So, especially after that mental health awareness month, I really made it known to everyone that I talk to, whether it be my teammates at the gym, coworkers, even, and my clients especially. And even I have a YouTube channel that has a decent following, almost like 10,000 subscribers. And I even made a video about that, explaining where I was with the mental health ambassador to let people know it's okay to reach out. If I can do it, everyone sees the big bad MMA fighter, admitting that I have issues too, letting people know that it's completely okay. So every single day I see my kids and I have a large majority of teenage males that think they're supposed to just bury their feelings and things like that. I say, no, that's, I tell you what, I did that. And that was a destructive path.
Mm-hmm.
So I try and let people know every single day that I can. If you're having a bad day, it's all right. Just like Liz said, I try to let people know I'm not having a good day. Try and let people know it's completely okay to not have a good day. So that's what I've been doing to keep, the stigma down, I suppose.
Thanks for sharing, and I'll definitely have to check out that YouTube video. So Michelle mentioned the theme that came up. Everyone has it every day. So Al, how about you start? Why do you feel that this theme, everyone has it every day, has the potential to make an impact?
Because I think it's going to allow people to understand that it is an everyday thing. Whether people consciously or subconsciously deal with it is a really big part of it for me. A lot of people might not think that they have these issues. They might think that mental health doesn't bother me, but it does. And I think by a slogan like that everyone has it every day, everyone is literally everybody. So that's the big thing about that slogan that I appreciate, is that no one's immune to it. No one's going to run away from it. It's kind of like, it's like breathing. It's there. It's going to be there every day. So that's my take on that.
Sure, we're all human.
Yeah.
Liz, how about yourself?
When we were told like everyone has it every day, I was like, that's a brilliant concept, because there are going to be days where your mental health is great and you're feeling so good, and then there's going to be days where you're not. And being able to have that slogan, when we talked to the kids in particular, that was like what I noticed. They were like, well, this is what I've been going through today. And I was like, well, tomorrow is always a new day. And I'm not saying that you shouldn't feel how you're feeling, but we can't stay low for too long. And that's one of those. Every day we're going to have something every day that comes at us in every direction. And on the radio, I always say you can't have a bad day. There's no bad days in radio, but that's not true behind the scenes. So for me, that slogan just meant everything. And no matter what your age is, no matter what you do for a living, you're going to have days that come out of nowhere where it's fantastic highs, and then of course the lowest of lows. And it's okay, because the next day we're going to just keep going with it. And it's how you interact with it and how you decide to switch it and keep going through.
Absolutely. Life happens. We can't control everything. And just knowing that, there's always that positivity that we can keep inside ourselves, I think is absolutely a great way to go about it. Well, thanks you two for taking the time. It was wonderful to meet the Avengers of mental health. And we will leave it there. So walk me through how you measured the success of the anti-stigma campaign. What kinds of data points, such as qualitative feedback and quantitative metrics, did you collect to evaluate the campaign? I'm really interested in understanding how you determine the overall impact and effectiveness of the project.
Sure. There was a lot of quantitative data that we were able to get, especially using social media, emails, doing a survey. So we've got the numbers of how many students we got input from in the front end of making this campaign, which I think is really important, right? It's the whole thing, like, don't do something for me without me. We involve the kids from the beginning. So we have some data from there. We also have data for, how many students that the mental health ambassadors went out and reached in different schools and groups. We have social media numbers where we reached tens of thousands of people through all of our platforms. We have email open rates, which went really well. We have YouTube video views and all of that stuff. Like Steve Bolger said, it's hard to get that impact of like that everyday impact, that qualitative, like, has it made people's lives better? Has it saved lives? Has it made people look at their days and their mental health differently. And that would come with expanding and scaling this campaign to really like give it some legs and give it some time. We hear it on an everyday basis internally here. I can tell you that it's worked with our ICAN staff and hopefully with our provider network. So we're talking, 550 to 600 people who are now another army of ambassadors who are out working day to day with people in their homes, in the community, and in schools. So it's working. With any great campaign, you need frequency, you need time, you need to hit people in many different ways, many different times, especially with the clutter that we live with now, right? With all this messaging and visuals that hit us every day. So, we got great numbers. We have really good, strong platforms. Now we're looking to expand and continue this so that we can get some of that, the feedback from the kids and be like, if it's the first time you heard this, maybe you were at Frankfurt Schuyler School that first time you saw NAS in May 2022, and now we're in 2024, 2025. Now you're going from middle school to high school. Did you remember that? Like, how did that help you in school? And I would love to be able to, put a piece of, a feedback mechanism into our campaign to be able to do that eventually. But the numbers were great.
So drawing from your experience reducing mental health stigma in the community with this project, what recommendations would you give to other agencies looking to implement their own successful anti-stigma campaigns?
So with this question, it really resonates with me on a few different levels. And I would encourage, and we have this conversation with our colleagues, that there's so much stress that is associated with doing the work that we do with a limited workforce at times. But any organization that is doing this work needs to look internal first. Look at our own staff, those people that are on the front lines. It's very easy to take for granted that our staff are out there and are the champions addressing the mental health needs of the community, but they themselves have mental health needs, and normalizing the things that they're feeling and supporting them in so many ways is the first place that my peers and those that are looking to do something similar, you have to do first. If you are not living it, believing it, understanding it as an employer first, then the goodwill and quality isn't going to trickle down to those that you serve, and then the message really falls a little bit flat. The other side is to normalize mental health. Really start to talk about it in ways, whether as an employer or in the course of delivering services, it's as normal as physical health and addressing our needs. So the more that we normalize it, especially as leaders, and being comfortable in your own skin and being able to ask for help and recognizing when we ourselves need a little bit more support, then that's a necessary step as well. And then the last piece, which we really truly try to embody here at ICAN, is to think outside of the box. And that's so cliche, and I know so many people say it, but in order to really have true impact with our kids in our community, it's doing the non-traditional things that will make all of the difference. And our mental health ambassadors that you hear from today certainly are doing that. But for us, we're finding ways to connect to kids and families in non-traditional ways that I would encourage others to do that. Whether for us, it's opening and operating a children's museum, it's opening and operating a sports complex. It's finding ways to get to kids and families in non-threatening ways, in paths that they're already taking, because it's, at the end of the day, for us too, it's normalizing and eliminating the stigma associated with asking for help. If you can ask for help, and we're having these messages and these conversations in a safe place, in a natural setting, it's so much more than just giving a therapist or a prescriber. And that's how we do it at ICAN, really thinking outside of the box and doing it in very non-traditional ways.
I would give it, I have my marketing and design hat on all the time, my creative hat. So I'd like to give advice to other agencies looking to implement something like this from that standpoint. So one thing I have learned and tried to practice as much as I can in my career is that it takes time. And don't think it's going to be a light switch where you're going to put out this campaign. And, we did it very heavily for a month. We took May, it was Mental Health Awareness Month, and we hit the majority of our stuff there. We have the resources and capacity to do that. It sometimes takes years, it takes a lot. When you're recruiting folks to do this type of work, like our mental health ambassadors, making sure that you're taking the right steps, because you have to build your relationships authentically with them and make sure that they're the right fit, and make sure that the steps you're taking, that they're comfortable regurgitating your messages and living and breathing it, because that's going to come out in the end, and that's what's affecting the kids. That's what's going to make them adopt this message or say, that was just some other dude who came to my school and I'm on to gym, or something. It has to come from an authentic place. I think the campaign slogan really hit. I'm super proud of it. It's, everybody's adopting it to the best of their ability, and it's resonating, right? It's being used. So how can we continue to do that? It takes time. That's with any sort of work, with gaining the trust of young people, with DEIB work that we're so entrenched in here at ICAN. All of that work in building new relationships with new populations and new audience takes time, and be okay with that. Put the work in.